to have a medication abortion, it takes 2 pills, mifepristone and misoprostol. Mifepristone was originally approved by the FDA for the ending of a pregnancy. That's why it is prime targeting by anti-abortion groups to have the FDA approval removed. And in recent news, a ruling coming out of Texas has decided, you remember that old lawsuit, the Hippocratic Medicine US versus the FDA? This ruling out of Texas has decided that that lawsuit can now be carried on by several other states who didn't initially put forth that lawsuit. Matthew Kaczmarek of the Northern District of Texas issued a ruling that is allowing the attorney generals of Idaho, Kansas, and Missouri to continue litigating the Alliance for Hippocratic Medicine versus the FDA. And even though none of these states are in Texas, he's allowing this case to move forward in his own courtroom in Amarillo, Texas. And this was after the Supreme Court in June decided that the anti-abortion groups that originally brought this case lacked legal standing to sue. And this is what we've been telling you as we've been following this legislation, is that court case, that decision by the Supreme Court didn't stop people from suing. It was a blueprint about how to sue better. It highlighted all of the flaws of their arguments and how it didn't have legal standing, and said essentially, you would have to make these arguments for us to hear the case. And what this lawsuit wants is nationwide restrictions on mifepristone, including prohibiting patients from obtaining the medication via telehealth, because this is how people in anti-abortion states are obtaining abortions. There's more about what exactly this lawsuit aims at doing, but something that I want to point out that's a little nerve-wracking is that this is going to be heard by the Trump administration. It will be Trump's administration representing the FDA in the case. Trump's administration, who he has repeatedly put anti-abortion leadership in charge of these types of things. Follow along, find me on YouTube, that Blue Butterfly app, because I will be following this court case very closely, because doctors should be able to provide evidence-based medicine to their patients.